everyone. Thanks for sticking around. I know we're kind of at the tail end here, so really appreciate you being here. We've got an amazing panel up ahead on financing for digital health. So we're going to be answering all the questions about the money, which I'm sure all the entrepreneurs in the audience will want to know a lot about. So I'm going to let my speakers introduce themselves because we had a few last minute changes. I think you already know me, Christina Farr, digital health reporter for Reuters.
Good afternoon. Jason Torres, Mansa Capital. We invest in healthcare IT, healthcare services companies that are disruptive.
Hi, I'm Steve Kraus. I'm a partner at Bessemer Venture Partners, and I focus in on healthcare broadly.
Rebecca Lynn, a partner at Canvas, and I focus on healthcare and also fintech.
Daniel Kraft, I'm a physician scientist, chair the medicine track at Singularity University, do some angel investments, and look at how healthcare is transforming through technology.
So for my benefit as a cynical reporter, and perhaps also for yours, can we start things off on an optimistic note? Tell me about the coolest piece of health technology that you have seen in the last, say, week, if anything, or the least cool.
Well, I just got back yesterday from Dubai from this really interesting summit. I flew over there with Steve Wozniak. It was really quite an interesting collection of people. And they had a museum of the future, part of it looking at the future of healthcare. And one interesting blend of neuroscience, mobile apps, brain-computer interface is the future of brain and gaming, and they actually had a demo there where you'd pick up a ball which had haptic feedback, and you'd play sort of a Microsoft Kinect game. The Microsoft Kinect type device would pick up your vital signs and your heart rate and adjust as you do the game. And if you know Adam Gasley from UCSF, they're now blending gaming, neuroscience, and sort of age function. I think we'll see a whole merger of that with augmented virtual reality. But it was interesting to play a moving game that reacted to your physiology that leveraged a whole suite of technologies that didn't even exist 10 years ago.
His is much cooler than mine.
Yeah, exactly.
So I just saw it's just last week, right? So a very early stage company that could take in, they had, I think, 80 or 90 different health ontologies and merge them all into one to actually make sense of the unstructured text in medical records. And the reason it's interesting is we've seen different companies based upon, certain ontologies, SNOMED or whatever. This one actually had pulled everything together in one spot and could process it many 100 times faster than anything else I've seen so far. So they're very early stage. It's a lexigram.
So I guess I could talk about a bunch of companies I saw, although I think the presentation by Michael O'Neill from Get Well Networks was like one of the coolest things I've seen recently. Just because I thought the passion of that guy was just amazing. So that to me, like, of anything I've seen in the last week, I sat there and I listened to him, and he was like, he totally resonated with me why we do what we do. And I could have invested in Get Well Networks a long time ago, and I passed, and it turned out to be a great opportunity. So I should have seen the inspiration of Michael. I would say that's the best thing I've seen in the last probably 2 weeks.
I feel like we're going from the most interesting to the least interesting, but without going too much into the technology, it's a company that provides services to the home, and they take risk, and what they're able to do is to load up care plans on an individual basis and price them out, and haven't seen that. And so typically what it's done is done very broadly. Okay, roughly this is kind of what the population is, this is what the costs are generally, and you're really at risk. But what this technology was able to do was really mitigate that on a granular, patient by patient basis, and so to me that was the most interesting.
All sound extremely cool. So can we just do a quick straw poll in the audience? How many people are entrepreneurs and currently fundraising? Okay, great. So this question will probably be useful for you. Do you have a thesis for your investment, or is it more kind of, just see something that you like and you want to back it? And if you do have a thesis, could you kind of sum it up in 30 seconds or less? Like, give us your elevator thesis pitch.
So out of Singularity University, I run a conference every year called Exponential Medicine. And part of the theme of exponential medicine is that technologies are moving quicker and quicker. The fact that our Moore's Law and our smartphones, sensors, all the things that are in digital health are moving quickly. So my sort of thesis for starting new companies or helping new ones is to build something that works today, but have your eye on where the puck is going to be in 2 to 4 years. Because, you know, we have the iPhone 6 today. What will the iPhone 8 be able to do, or the convergence of sensors, AI, big data? So you need to build something that has a product that will sell into 2015, but have 2018 in mind and 2020, and ride those exponential waves. Because if you know that HealthKit is coming, or Microsoft HoloLens, how might whatever you're building layer into that? So part of the thesis is to look a little bit far downstream and don't have a failure of imagination about how quickly things are getting faster, cheaper, and better. And when you start companies now, as was mentioned earlier today, you can do that for much less capital.
Yeah, we're very thesis-driven. Actually, Rebecca said something at a conference that we were at together last week, which I really liked, which is sort of reinventing and reimagining healthcare, I think is what the term she used. I've always tried to capture what gets me so excited about this time. But at Bessemer, we're very thesis-driven. Probably 80% of our deals are what we call on-roadmap deals. 20% are reactive, where we get them from friends or across the transom or what have you. 3 theses that we're working on right now is the disruption of the whole payer stack, the insurance stack. I can think the entire insurance stack will be disrupted. It already has been. The second is the consumerization of healthcare, particularly looking at great companies around healthcare search. And the third that we're looking at right now is sort of the new care provider model, what Jason talked about around taking risk, and what that's doing to the whole provider sort of care continuum is really interesting to us. So,
Go ahead.
So we also we believe in being very thesis-driven. We've had a pretty in-depth healthcare thesis since '09, and that's led us to investments in Practice Fusion, Doximity, HealthLoop, and most recently Vuex. And so we refresh those theses from time to time, and this whole reimagining healthcare is something that I'm really very passionate about in terms of how we see healthcare in the future, and just not assuming that what we think today is how things are going to be going forward, right? And I think historically we haven't allowed ourselves to think that the system could change, but when you start moving money and incentives around, it indeed can. So we're seeing that. And what I really like right now is a focus on data being used to drive better decisioning going forward. And I'm not talking about data in clinical studies or data sort of in medical records as much, but what I firmly believe is there's a crowd sort of data out there that is incredibly helpful, that doctors will tell you, no, that doesn't actually happen, but you talk to 5 moms who've had that happen to their kids, and like, it absolutely does happen, right? And so I can name dozens of examples of these correlations. I think, food allergies are probably very correlated to the use of antibiotics under the age of 2. There's no studies out there really to go for that, but I would bet money. I think the issues that women have with thyroid are probably related to use of birth control pills. And then most recently, but again, no study, but how do you get that data? How do you correlate that data? And then most recently, ADHD and the correlation of that and sleep issues. So the correlation of ADHD diagnoses and not taking kids' tonsils out anymore. And so for me, I've been really looking at, how do you get that data? It's not going to be in medical records. You won't find it there. It's not going to be in clinical studies. How do you get the community to help produce that data for you?
And just a follow-up question on that. Do you think that one of the places we might get that data is from patients? And do you have any theses around mobile health going forward?
I think everything's mobile going forward, so I think it will come from patients, and there's sort of this social network combined with the big data element that I haven't quite seen yet. But again, you remain open to looking at a lot of different companies in order to find the right one. And
what about selling of data as a business model? And that seems to be kind of a contested area with startups.
Yeah, it's interesting. I think, again, you have to let your imagination go here. If you look at past record, I think IMS Health is really the shining light for that, and there are a few others. I actually had an email that I sent out to 12 people in healthcare saying, please give me examples of companies that have built a great high multiple business on the sale of data, and there were few, and IMS just came back time and time again. So I think this is one area that we can't be too cynical about, and that we have to sort of reimagine in a way, and we have to really think about how that data is going to be used and who's going to who's going to benefit from that
Well,
data.
in essence, I mean, the government's selling your data right now. I mean, CMS has made moves to open up the government data. So, and there are, private institutions which are qualifying to be qualified, adopters of that data, some of which are startup companies here in the valleys. So, I mean, it's happening. It's obviously on a de-identified basis, but...
And there's CalIndex also, right?
Yeah.
So CalIndex is 8 million lives that is open for people to hit against.
And do you think we're going to see kind of the rise of revenue sharing models with companies that do sell your data, giving patients potentially a little bit of a cut? A good example is 23andMe makes, currently sells data that it collects. For a test, it's very cheap, $99. But there has been questioning in the press of, maybe we should have a cut of that data. What do you think?
In general, I think we're starting to see the alignment of incentives that you can be a data donor and maybe get something back. I mean, take the example of Google Maps or Waze. When you drive today, you share your privacy, your speed, and your location. Actually, Google tracks you can look it up if you find the right link, where you've been. But in response, you get something back as a driver, the maps, the traffic, the better way to get to work or wherever you're going. We'll see that some of that sensibility, and so you can opt in, and we're now in the social sharing economy. The new generation's more comfortable sharing. I don't think you always have to be paid for it monetarily, but want to get something back if you share your genome, your microbiome, your digital footprint in healthcare. There'll be ways to monetize that, but also if you let the consumer, who gets more engaged and empowered, bring some visibility into that, i.e. the Google Maps version, it'll be interesting. And Google, by the way, is now getting back into Google Fit. There's Google Baseline. It's going to be interesting to see these larger companies who have consumer touch hundreds of times a day integrate that information.
There's a number of new models just throughout healthcare which are developing now that have risk sharing, where there'll be gain sharing, or that are incentivizing behavior for providers, for subs to provide services and integrate in a different way. And so, yeah, information is going to be a big part of that, and to really drive the disruption in healthcare.
So let's talk more about financing, as that's our topic. What are you looking for in a team? Do you want to see a mix of tech background and also health working together, or would you prefer to see kind of a straight kind of team of doctors and people with experience in healthcare? What's kind of the dream team for early stage startups?
I think that's changed over time. I mean, I think it's one of the really interesting aspects of where we are at this point in time in sort of healthcare IT, digital health, the health revolution we're in. 10 years ago, the teams looked a lot more like the gray-haired doctors or, experienced healthcare, executives who were starting their company. And nowadays, you see a whole host of first-time healthcare entries into the system and bringing really advanced, development skills and UI product design chops into what is a pretty outdated technology field. And so I think that's a really interesting point in time. Now, I do think there have been some mistakes made by the first generation of entrepreneurs who came into this field, in the last couple of years. There were a lot of B2C models which frankly just did not fly based on the payment schemas of healthcare. And you see a lot of these companies which have really interesting teams and business models pivoting, because I think people have realized that healthcare is really a B2B2C business model as of now in terms of who pays. That's going to change over time, I think. I mean, I think consumerization is happening. But, so I think today the perfect team, to my mind, is a blend of tech, a blend of healthcare expertise. But it's definitely changed. I mean, it wasn't that way 10 years ago. And so that's what makes it really exciting to invest in today.
We'll look a little bit more on the softer characteristics of the team or the CEO. So we'll look at what we call magnetism or the charisma. And can the CEO attract top talent? Can they attract capital? Have they been able to demonstrate that? We'll look at authenticity. How authentic is the idea? How authentic is the skill set? Does it match? Is there a lot of overlap? We'll look at the ability to evolve. The skill sets that they have today are not going to be the skill sets that they have tomorrow, and do they have enough intellectual honesty to look at themselves in the mirror to say, okay, we need to beef up here? Do they take coaching? And do they have the legs for it? Do they have tenacity as a team to go through that development stage of from startup through growth through maturity? Those are big asks. And so that's really how we think about the skill sets that we look for in a team and in a CEO that we back.
I would say, putting my physician hat on, make sure you really understand the unmet need and bring in some clinical folks who've been in the mix. It's good to have some gray hair perspectives and also really understand the culture you may be trying to shift. So have a team that's balanced or brings in an advisory group that can look at it from different angles.
So, what's been overhyped in health tech? Because it seems like an area that's gotten a lot of attention kind of in recent years, particularly with the big Silicon Valley players like Apple and Google starting to make moves. What are you kind of not investing in because you think it's kind of just gotten a lot of hype, but there's nothing really backing it?
Look, I just want to see a company that doesn't have Athena Health and Castlight as a comparable. I just want to see that company.
I think maybe I'd say wearables. It's so common now, but they're going to be disappearing into all our other. They're going to become commodity items. The big, I think, element will be the actionable data or information you can pull out of that. So there's several new companies who are building the sensor platforms that sort of integrate the data from any sort of device.
Yeah, it's interesting. I don't know. I mean, I would agree on the wearables, right? This proliferation has just been pretty astounding. And then it is interesting. I mean, you asked about what's changed in entrepreneurs. I think there's a lot that's changed in VCs, right? I mean, when I did practice in 2009, and they had to go get their Series B in 2010, I could count on one hand who actually had any healthcare IT experience at all, right? And there were no healthcare IT incubators at that time. And now what you're seeing is just this proliferation. Now I think it's 120 last count when somebody bothered to count worldwide. So what you've just seen is this, not only this change in how the companies look, but this change in how the VCs look. And you see a lot of VCs sort of jumping in and funding a lot of these companies that are, the Me Too kind of companies, right, that have been around for a while. So it is interesting to see how the whole space has shifted in a very short period of time. And healthcare was a third rail for a lot of people. When I did practice, I had 2 VCs at other firms pull me aside and say, what are you thinking? So many venture capitalists have sort of died on this third rail of healthcare. It should have changed a long time ago. It didn't in the last cycle. But there were reasons we believed that it was just different now. And so things have really evolved. I think almost every VC firm out there has a healthcare company in their portfolio at this point in time.
It's interesting. I was over at Rock Health, one of these accelerators, a few days ago, and Hallie and I were talking about this thing she's calling death by pilot, which is startups that have gazillions of pilots but no actual customers. So I'm wondering, just from your perspective, what actually stands out to you as a sign that this startup is really taking off versus something like having a ton of pilots but no customers, that's something that kind of flags you in the opposite way?
For me, I mean, there's all the VC generics of team and like that, and et cetera, which matter. I totally agree with what Jason said. All those qualities, I mean, you can kind of sense them right when you spend an hour with someone. So that's the most important thing, is you get that right. But I think beyond that, when it comes to business, I want to see ROI. I want to see a value prop that really resonates with me and also with customers. It doesn't have to be a lot of customers. It actually doesn't even have to be a customer. But if someone comes with a really well thought out value prop that is really quantifiable and actually can be measured in a sort of finite period of time, I'm willing to make a bet. I can the number of times entrepreneurs come in and they haven't actually thought about the value prop. And the ROI. That to me is the most important thing. And you can talk to customers, and within a second as a VC, you can figure out whether they see an ROI or whether it's like, yeah, we're trying and we've got 50 other pilots and we're going to feel out every player in the space. That's what I'd look for.
Well, one gauge that's new and evolving is crowdfunding. I mean, the Kickstarters and the Indiegogos. So one of the companies that started out of Singularity University is Scanadu. They got $1.6 million to do the clinical trial, 10,000 of these little Scanner Do Scouts are shipping this month, and that can gauge early interest. It's not exactly a pilot, but the customer's already paying $200 to get one of these and be part of the crowd-funded, FDA-approved testing. So that's one early gauge.
I'd like to see renewals. So if there's a renewal, if there was a term that if they did a pilot and they're now getting into commercial contracting and there was an opportunity for them to go someplace else and they didn't, they came back to that customer, we like to see that.
I like to see customers actually paying money. It's kind of that simple.
All right, so that's the parting words for you for our panel. Thanks so much for listening. I hope it was useful. And have a great evening.